Hello, friends. I am so excited for office hours. I feel like, all right, let me sit down a little. What if I just like slowly lowered myself out of frame? I'm so excited for office hours, you guys. This is going to be a blast. If you are new here, office hours are a thing that we do for our YouTube members. It is publicly viewable, but the chat is members only. So if you want to hang out and talk with me, if you want to share your stories, your insights, ask your questions, etc., then definitely go ahead over to the community tab where you can join our YouTube membership, and then you can do that just like June just did. Thank you so much, June. I'm so excited to have you here. So today's office hours, we're going to be talking. Sometimes we just do it as a like kind of a free-for-all, what questions you have, what do you want to talk about, and then sometimes we do a theme. And today I was feeling like we got to talk about your first nursing job. I just know that if you are out there and you are getting ready to graduate, you are getting ready to enter the job market, you are freaking out because you have heard 150 different things from 150 different people. And you are probably a little bit concerned and worried about your first job. And I get it because I was also. So I'm going to tell you all of the things that I have to share with you about when you should apply, what you should look for. I'll talk to you about residencies. We'll talk about green and red flags in terms of what to look for in jobs. We will talk about resumes, things to expect them to ask in your interviews, all of that kind of good stuff. Thank you so very much. I'm really excited, you guys. This is going to be the best. I have such a passion for helping new grads to succeed, for helping new grads to find their niche and their place in nursing. And becoming a new grad means that you first have to find that job. So let's talk about it a little bit. And if you are a YouTube member and you want to ask me a question, you've got anything you want to say to me in the chat, please just at any time. You don't have to wait for there to be like a break in the conversation, because the way it's going to go is I'm just going to talk at you until somebody interrupts me with a question. So feel free to interrupt me at any time. Let's talk about first, before we do anything, let's talk about the fact that the guidance for this is going to be different based on where you live. So first and foremost, I would encourage you to attend job fairs, to reach out to potential employers directly, and to get their input on things. For instance, when I was in my senior year of nursing school, we had like several different representatives from hospital systems come and speak to us, and they all told us when they suggested applying. And here in Ohio, they said to apply 4 months before graduation, not 4 months before you plan to take the NCLEX, 4 months before graduation. Now, I know in some places the job market is more competitive, so you may need to start earlier. In some places, it is less competitive and you may have plenty of time. But in general, I would say that 4 months is a good amount of time prior to graduation if you are looking to secure that job right away. If you are looking for a job that is in med surg or that's in a clinic setting, it may not be necessary for you to apply early. And the reason I say that is because a lot of these places are used to taking new grads. They don't have any sorts of like fellowships or residencies or anything like that. So they may be it may be easier to transition into that job. I'm not trying to say it's easier to get that job, just that it will take less time in planning and organization and things of that nature. So, if you are interested in a specialty, though, I strongly encourage you to reach out to somebody who works in that specialty, to reach out to the unit educator where you want to work, to the clinical manager, whatever it may be, and ask them, I want to work for you. I want to work on your unit. When should I apply? Because a lot of that stuff, when you are going for a specialty, it may be competitive. There may be a fellowship or a residency with certain start times, and you don't want to miss it. So do your due diligence ahead of time. Do your research ahead of time so that you know the cutoff to apply for this residency position is September 1st. So I got to get my ducks in a row and start applying earlier. So June says, I plan to take NCLEX and then go straight to a BSN program. So what do I say when they say why you haven't worked since getting your license? So great question. You can work as a nurse with and also be getting your BSN. So if that is something that you are interested in, like I work with a nurse who she graduated from an ADN program. She started working right away as an RN, and then she was working on her BSN while she was working as an RN. She did it concurrently. So that is an option. But if you don't want to pursue that option, if you are saying, I want to just focus on my BSN before I do anything else, totally cool. And I would say exactly that. Why haven't you worked since getting your license? I would say, I chose to focus on my education. It was really important to me that, I give my undivided attention and focus to pursuing my BSN because that was where my priority lies. I know that I can do great things for this institution once I am a BSN or whatever the wording is that you want to say. So yeah, just being honest with them about it. I want to be able to give my full attention to my new grad position. And I knew I wouldn't be able to do that if I was splitting my attention between the hospital and the program, whatever you want to say, however you want to put your spin on it. So 4 months prior to graduation, not NCLEX, graduation. So I'm sorry, I'm getting over a little cold, so I will be hydrating. 4 months prior to graduation is when I would start applying to positions. And note that I said applying. At any time, I would start doing the research to figure out where is it that you want to work? What is it that you want out of your first job? Maybe like me, my priority was I want to be in the emergency room. I want to be in the emergency room. I don't care about which facility. I don't care about which hospital system. My priority is specialty placement unit. And that might be your priority too. Maybe you're like, I want to be in the OR or whatever it is. And that's your priority. Okay, then you got to start researching all of the OR stuff, all of the OR fellowships, all of the OR positions. What options are there for me as a new grad? Maybe your priority, sorry, my son is yelling. Let me text my husband. Maybe your priority is not working in a specific unit, but rather working for a specific facility. Maybe you say, I want to work for this hospital system, and that is the thing that is the most important to me. Awesome. Now you've got to start doing your research into what it takes to work for that facility. And also specifically within that facility, do you want to work at a specific location or do you just want to work for that hospital system in general? Do you want to work for a specific clinic location or do you just want to work for this conglomerate of orthopedic clinics or whatever it might be? Figure that out and get your priorities straight there. That will help you to guide your job search. That will help you to guide your thinking so that you're not just kind of blindly casting a net out into the world and saying, I'll take any job that comes my way, right? That's not what we want for you. Okay, here's a question. Hi, Maris. Hi, Jay. Thank you for joining membership. Do hospital recruiters look at experience? I have zero experience except being a nursing student. I'm worried I will have trouble finding a job. Fantastic question. So first and foremost, I want you to remember that you have experience in your life, even if it is not medical. So for instance, when I was applying to positions, I did have like some medical experience. However, there were also things that I had done in my life that I could use to build my resume and my skill set. So when I was the assistant manager of GameStop, oh yes, your girl is very nerdy. When I was the assistant manager of GameStop, did I have to, manage direct reports? Absolutely. Was I responsible, for customer service and customer customer relations, absolutely. And all of that stuff is important to say in your interviews, in whatever it may be. I had a friend who was a bartender throughout nursing school, and she talked about how tending bar was, she had to have time management and figure out what tasks to tackle first and where to spend her time, attention, and energy. She had customer service, etc. All of those skills are absolutely marketable for you as a new grad. They translate to you as a nurse, because do you think that I have to have great time management? Absolutely, I do. Do you think I have to have excellent customer service? Absolutely, I do. So it's one of those things where pull from whatever experience you may have. And if you haven't had work experience, that's okay too, because what you can say then in your interview or whatever it may be is, hey, I knew that I wanted to be a nurse, and that's what I decided to go after right away, because I am so passionate, right? Because I am so focused on being a nurse. That's what I want to do more than anything. So there's always a way to spin things. Additionally, if you do have experience, in my experience, if you have previous medical experience, absolutely you should be calling that out. You should be telling them, I worked as a patient care tech, I worked as a medical assistant, I'm a respiratory therapist, I worked in, I was a pharmacy technician, I was a phlebotomist, whatever it may be. You want to tell them that, because some places calculate your base pay, your rate of pay, um, taking in that as a consideration. So there are absolutely places that will say, oh, well, she had 10 years of experience as an EMT, as a medical assistant, whatever, and they'll bump your pay up a little bit. So whatever you have, definitely tell them. How do I pass the med-surg lecture and proctored test? Absolutely. So you want to watch our med-surg videos. Kathy has med-surg videos for a lot of body systems, almost all of them. We have our medical surgical nurse squad study card game, and we have, of course, our med-surg study flashcards, like the actual flashcards that you can use. And I would strongly suggest using the flashcards along with the videos and the Nurse Squad study card game. All of it is available on our website, leveluprn.com. And that is what I would suggest doing. That is how I passed all of my ATI proctored exams, was using the flashcards and watching Kathy's videos. So I hope that helps. Now, when it comes to things like fellowships and residencies, I want to explain to you what those are, because a lot of people don't have a good understanding of them. Some people think that a residency means that I won't practice as a nurse. Sorry, my son is screaming. I'm trying to tell my husband. I won't practice as a nurse independently during my residency, and that is very much not true. So if you are concerned about that, that's not what a residency or a fellowship is. A residency or a fellowship typically may have like a little bit of a longer orientation, but just like by a couple of weeks. And the it's more about giving you additional support. So you, as a new grad, have a lot to learn, no matter what kind of a unit you're on. So a residency or a fellowship is about giving you sort of like a specialized, like laser targeted way to support new grads. So there's a couple of things that I want to encourage you to do. First is ask questions. There's probably information on that hospital's website or whatever it may be where they talk about their residency or their fellowship. And you may have a place to ask questions. They may have frequently asked questions, whatever. A couple of things I want you to look for. Is there a requirement for me to stay for a certain amount of time? Is there a contract? What happens is, because like my residency was a year long, but I didn't actually have a contract. There was no penalty to me if I left the hospital system within a year. So you need to ask, what happens if I leave before the residency is up? Some places will have green flag residencies like this one, where it's okay if it's not a good fit, that's all right. And you're not going to suffer any penalty. It is a red flag, in my personal opinion, experience, and just from my context, it is a red flag for a hospital to offer a residency or a fellowship that comes with a contract. You are doing them a favor by working there too. Yeah, they're doing you a favor by training you for your first job, but you're also working for them. It's not a one-way street. You are an employee for them. So it is very important that you be on the lookout. I'm not saying don't do it. I'm just saying be aware, because in some places they will offer you things like sign-on bonuses, but they will make you pay it back if you leave before the contract is up. Some of them won't make you pay it back. They just won't pay it all out at once. Some places, if you leave before your new grad, contract is up, you will be put on a do not hire list. So ask them, is there a contract? Is there a requirement to stay? That's a red flag to me. It doesn't mean don't do it. It means investigate further. And the further investigation I would do is, what happens if I leave? What happens if I have to move? What happens if, I need to take a leave of absence because of somebody's health, or, whatever the situation may be? Find out in writing what the actual terms of that contract are, because you don't want to be behind the ball and suffering as a result of that. Um, okay, June, listen, this is my soapbox issue. So if you haven't been listening, I want you to sit down and listen really good right now. I've had nursing instructors say start in med surg, and I hate med surg. Is that true? Absolutely not. With 100% certainty, I can say that you should start in the specialty of your choice. Med-surg is a specialty. So if med-surg is where you want to start, by all means, start in med-surg. If ER is where you want to start in ER. If ICU, OR, clinic, community, school nursing, if any of those places are where you want to start your nursing career, do it. And I will tell you why. Number one is that there's no they're different jobs. If your ultimate goal is to be an OR nurse, yeah, having med-surg experience will help prepare you for that, because having experience as a nurse of any variety will help prepare you for that specialty job. But med-surg experience doesn't uniquely prepare you for the operating room, for the ER, for the ICU. Secondly, if this I'm so passionate about this. Think about it for a second. If I'm an ER nurse, doesn't it make sense that I learn how to be a nurse in the field where I want to work? Like, doesn't it make sense that you would want from day one for me to be trained up to think like an ER nurse, to act like an ER nurse, to have the skills of an ER nurse? Don't you think like that makes more sense? I sure do. And I will tell you that as someone who started as a new grad in the emergency room, I learned on the ground running, right? Like we hit the ground running, and I learned how to be an ER nurse starting from day one. And I learned how to think and function in that ER, how to take report, how to give report, how to do all of the skills that matter for me as an ER nurse. And I'm good at it. I like it. I thrive there, because that's where I got my education and training, was, my new grad year in the ER. I see people who come from ICU or med-surg or 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 wherever it may be, who have been nurses for a long time, right? And maybe not even in that one location, but just in general, they've been nurses for 10 plus years. And I see them come to the ER because they decide ER is where they want to be. And that's cool. And I am not knocking this at all. You should absolutely go after whatever it is you want. You should switch specialties if you don't like what you're doing. But I often see these nurses struggle with their time management in the ER, struggle with their skills, things like starting IVs, things like knowing which patient to see first, knowing when to drop care for the boarded patient to go take care of the critically ill ER patient. And it's because they were trained to think like a med-surg nurse, like an ICU nurse, whatever. So if you are interested in certain specialty, you should go after that. And also, if you are not interested in working bedside, if you are not interested in working in a hospital setting, Don't do that. There are endless ways to be a nurse, and you do not have to start in med surg. You will hear this because this actually used to be the case. This did used to be the truth. It's not the truth anymore. Go after your passion, and if anybody gives you any flack about it, send them to me, and I will set them straight. Yes. Okay. And also for NICU, absolutely, you can go straight into NICU as a new grad. With 100% certainty, I can tell you that this is the case because I have one of my best friends from nursing school went directly to a level 4 NICU as a new grad. You see it all the time. One of my other best friends from nursing school, she went to a level 2 NICU and then later went to a level 4. There are so many ways to get into the specialty that you want. Now, when it comes to that specialty, whatever it is, keep in mind it's probably going to be pretty competitive. And if you are applying for a program that has like certain start and end dates, like a fellowship, where they only take X number of applicants, that's something that you got to really get in tip-top shape. You got to have, all of your ducks in a row. You want to have letters of reference ready to go. You want to have people that you can send them to as references. You want to have some certifications. And I say maybe because I did not choose to go into job hunting with anything other than CPR. I wanted my job to pay for my certifications. So I didn't have ACLS when I applied. I didn't have PALS when I applied. I let my job pay for those skills, for those certifications, because they're expensive, they're pricey. But if you live in a place where the job market is competitive, such as California, it may make sense for you to go ahead and do those things. And again, I would encourage you to reach out to nurses who are actively working in your area, to people who are new grads in the area, and ask them what they did, because geographically things are different. So the other thing is, I strongly recommend looking into whatever the professional organization is for your desired field. So if you are interested in being an ER nurse or a trauma nurse, I would encourage you to go ahead and join the Emergency Nurses Association, the Society of Trauma Nurses. Both of them have student membership options that are vastly cheaper. And I also encourage you to just maintain those memberships, because you can get free CEU hours. You can get discounts if you decide to go for board certification. You can get discounted testing, discounted study materials. You'll get their journal in the mail, and it's important to stay up with those articles and new evidence-based practice. So it's a good reason. It's a good suggestion to join in general. But you can join as a student, and then you can put it on your resume. And I absolutely would encourage you to do that, along with anything that you are doing in your school and in your education. So for me, like I did my school's student government. I did my school's student nurses association. I also did my state level Student Nurses Association, and I served 1 year as like the PR director and 1 year as the president of the association. So you better believe I had president, Student Nurses Association of Ohio, PR director, Ohio Student Nurses Association. I had president of my school Student Government Association. I had, co-communications director of my school's Student Nurses Association. I had all of those things on there because you want to show that you are involved, that you have leadership and advocacy in whatever way it may be. And I'm not saying you have to do those things, but look into those things. Maybe there's a special interest group on campus. Maybe there's a volunteerism group. Maybe there's something that you do in the community that isn't related to school at all, but something like I volunteer with the this, that, and the other club, or whatever it might be. I'm a hospital volunteer. Awesome. Put that on your resume. Put your GPA on your resume if it is impressive. But by impressive, I mean outside of the norm. any GPA in nursing school is impressive that you graduate with. And so please don't misunderstand this as me saying that I'm GPA shaming. I am not. But what I am saying is you don't want to put an average GPA on a resume because it's kind of just expected. Like, yeah, you did all right because you graduated. So if you have a stellar GPA, I would say anything like 3.8 and above, 3.85 maybe, then definitely call that out on your resume and tell them that. You absolutely can and should list your clinical rotations. So you want to list, fundamentals. I did 196 hours on this floor at this hospital. List it like a job. You don't need to give all the details and everything, but you want to say how much you did and where you did it. Because also remember that not every program is the same. Yes, there are state level requirements. So Ohio says, and this is made up, don't stick to this. Ohio says that you have to have 100 hours for fundamentals of nursing, but I did 196 at my school. You want to call that out, and say how many hours you did, especially if it was above and beyond what the state level requirement is. You also want to say if your school does like preceptor evaluations or like clinical evaluations, where at the end they have to say if you were satisfactory or not. Tell them, did you get 100% satisfactory clinical evaluations? You better put that bad boy on your resume. Tell them that stuff. And again, remember, like I said, you are applying as a new grad. You are applying as a student, really, because this is 4 months before graduation. So they know that you don't have your RN yet. They know that you don't have your BSN or your ADN or whatever it is. Put whatever you do have and leave the rest off. They know that you're a student. It's okay. So like now, if I'm applying for a new nursing job, I'm not putting my clinical rotations, I'm not putting like that I was the president of my student government association. That's not like really applicable anymore, but it is when you're a student. So the other thing that I was going to tell you is when I was applying as a student, I had like name on the resume, Maris Schuarter, and then like now it says like BSRN, CEN, TCRN, and it says like certified emergency and trauma nurse, because you want to be like attention grabbing, right? Then I didn't have any letters, I didn't have any credentials, so it said Maris Schuarter, and then it said registered nurse candidate, is how I chose to put that. There are a lot of different ways that you can do it, but the reason that I strongly encourage you to have registered nurse or licensed practical nurse or whatever kind of nurse you are, somewhere the words in your resume, which is why I said registered nurse candidate, or registered nurse student, or whatever you are. The reason I did that is because there are applicant tracking systems. They're called ATS, and these systems function by when you hit submit to a job, and they use these for corporate stuff too. They take your resume, and I would encourage you to have it in Word or PDF, but specifically Word. They take that resume and they upload it to their ATS. And in their ATS, they are looking for specific buzzwords, right? There are words that they are looking for, and the more of those words that you have in your resume, the higher up you move in the applicant tracking system, the more likely your resume is to come across the desk of a real human being. So now my resume has words like certified in it. That's gonna bump it up. It has words like ACLS and PALS. That's gonna bump it up. So wherever you can get those words in, and again, it depends. I mean, like, I don't actually know what they are for every job, every facility, but whatever you can do to kind of get those buzzwords in, you want to do it. Where do you find generic reference letter to give to someone to fill out toward that nursing job? Great question. I don't know that I've ever actually done that. I usually just ask people for a letter of reference. And then if they feel comfortable doing so, they have just written me a letter. It's important to share with them what it is that you are going after. So for instance, if they are writing you a letter of reference, I'll give you the perfect example. When I was applying for my doctorate program, I said, to the people that I had, I had to have specific letters of reference. I had to have a clinical like manager or instructor. I had to have like a boss, and then I had to have a professor. And I found those people and I asked them, would you write me a letter of reference? And they said yes. I then gave them information on the program. So I'm applying to Ohio State University's BSN to DNP to become a certified nurse midwife. And this is about the program. And here's a link to their website. You want to tell them about the program so that they know what kinds of stuff to hit on. Oh, this program really values evidence-based practice. Oh, Maris is blah, 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 evidence-based practice, right? So you want to give them the information about what it is that you're applying for. I'm applying for the residency at XYZ hospital, whose values statement says that they value blah, blah, blah. So that then your reference writer will say, June really embodies the value that you share at Ohio Health of XYZ, whatever it is, and they'll give an example. I would also provide them with a list of things that you have done. So what are your accomplishments? Maybe it's your GPA. Maybe it's some sort of advocacy in the community. Maybe it's stuff that you do on campus. Did you work as a tutor? Like all of those things, because they may not know the specifics of those things. So you're going to give them specifics about what it is you're applying for or that you need a reference for, and specifics about you and what you have done of merit, of note. And then that helps them to kind of be like, I'm writing a letter on behalf of June Same, and I am, she's applying for XYZ position, and she truly embodies those values, blah, 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 and that's a really good way to start. Worst case scenario, I would just Google like nursing letter of reference or, something like that. And I'm sure that there's like templates out there. I've never used one. Okay, let's talk about interviews because I know someone out there who isn't a member is like screaming at the screen right now. They're like, Maris, I have questions about what's going to happen in this interview. Absolutely. And I can give you some information because obviously every interview is going to be a little bit different. I interviewed one time for a fellowship position that I chose not to go after because they couldn't guarantee me ER. They were going to put me in ICU. And I was like, I would rather die than be in ICU. More power to our ICU nurses. But when I interviewed for it, it was a panel. It was virtual. It was a Zoom interview, but it was a panel. And so I kind of was not prepared for that. I hopped on and there were 3 people and I was like, oh, and that's okay. You can roll with the punches, but it's just a different sort of atmosphere than a one-on-one. So just be prepared that it could be anywhere from one person to a whole panel of them. And you got to just show up like you own the place. You must have confidence. You must come as though you have already gotten this job. This is my job and I'm just here to prove it to you. Confidence is nobody knows if it's earned or not. So you just got to show up like, yeah, I'm here to tell you why I have this job. And that's going to be a big part of it. Another big part of it is your physical appearance. Do not wear scrubs to the interview portion. The caveat to that being, when I went for my peer interview, which was a shadowing interview, yes, absolutely, I wore scrubs. And if they tell you to wear scrubs, then wear them. If you have any question or concern at all, clarify ahead of time. Dear Ms. So-and-so, I'm really looking forward to meeting with you on Friday, confirming the interview. I just wanted to confirm, and you can put it in these terms too, because it makes it sound like you know that this is a thing. Will this be a shadowing interview where I should wear scrubs, or is business casual appropriate? They will then tell you, but it's better to ask the question than to show up and be in the wrong clothes. So make sure that you have you got it together, right? If they say business casual, it's business casual. It's not club wear, right? It's not something that I might wear to a date night. You've got to be like ready. And personally, I have an interview outfit that I wear. It's an outfit that is absolutely business casual and workplace appropriate, but also makes me feel good. I feel like I look good in this outfit. I'm ready. And that gives me that little extra boost of confidence, right? And when in doubt, wear black. That's my thing. Wear black and you will have that little extra confidence boost. So for those kinds of interviews, they're going to start off by saying, "So tell us about yourself, Maris," right? So they're going to ask that. So you need to have your 2-minute elevator pitch ready to go. And you want to have practiced it. You don't want it to sound rehearsed, like you don't want it to sound memorized, but you want to be able, and this is, oh, hi. So my name is Maris. I'm a recent graduate of Chamberlain University. I graduated in April with my BSN. I have previous experience in emergency medicine, both as an EMT and working as an IB specialist in a level 2 trauma center. I'm passionate about XYZ, and I'm really looking forward to telling you about why, I would be a great fit with your facility. Whatever it is, whoever you are, you don't want to be caught off guard though when they ask you, "So tell us about yourself," because then you're like, "I was born in Texas and I lived in Virginia." Nobody cares. That's not that. Tell us briefly who you are in relation to why you are here today. So that kind of stuff you want to have it basically ready to go. Not memorized, you don't want it to be a script, but you want to know what you're going to say. The next questions that they will ask you are going to be, "Tell us about a time when." Tell us about a time when you gave excellent customer service. Again, doesn't have to be in medicine, right? It can be in your clinical rotations. It can be in a medical experience. I have medical experience as a phlebotomist. Okay, great. Tell us about that. Or it can be, so I used to be the assistant, and talk to them like they're friends, right? So, I used to be the assistant manager of a GameStop. And one time, I had this guy come in on Black Friday and blah, 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 right? It doesn't matter that it's not about medicine. They want to hear you be able to think on your feet and to be able to answer the question so that they can see if you're able to function within this unit. One of the things they asked me was, um, for ER, they said, "Tell me about your learning style." And I thought that was a really good question. Tell me about your learning style. Do they actually care what my learning style is? No. What they care is that I'm going to say something along the lines of, like, "I am a quick learner. I am easily adaptable. And this is my motto, see one, do one, teach one," right? That's the kind of stuff that they want to hear. Whatever kind of a unit you're going to, they're trying to make sure that your personality, that your goals match with what their goals are, and the personality and culture of their unit and the things that they want in a nurse on that unit. So the answer that I give for the ER might not be a great answer for ICU or OR, whatever it is. So it's not about whatever the story is. It's about, are you a good fit? So always be ready. So tell us about a time you gave excellent customer service. Tell us about a time you made a mistake. That I can almost guarantee you, or that something didn't go well, or, that you had a scary clinical experience, something like that. You got to be ready for a time that you didn't do great. So tell us about a time you made a mistake. You don't want to just tell them, "Well, one time I did this and it was terrible." No, no, no. So, in one of my previous clinical jobs, I one time I mislabeled labs for a patient. And that was a really terrifying experience for me because I realized in that moment that, I really am the last stopgap for medical mistakes or whatever it is. Talk about how it was a learning experience for you. Talk about not what the mistake was. You really want to minimize that part, but what you did about it, how you corrected it, how you learned from it, how you apply it to where you are now. So be sure to be able to use those negative questions to make yourself look good, right? Same thing with, like, "What's your biggest weakness?" "My biggest weakness is that I'm too nice." Like, no, like that's so fake, it's not good. They want a real answer, but you've got to be able to spin it in a way that is going to be helpful. So for me, I might say, "Well, I have often struggled with time management." Time, and right away they're like, "Oh." time management. She's going to be an ER nurse. Oh my God. So I've often struggled with time management. And it wasn't something that came naturally to me. But because I struggled with that, I had to find ways to compensate for it. And so it is still something that I'm actively working on. And yeah, there are days that I still struggle with my time management. But because this was something where I didn't do so well, I forced myself to learn how to adapt and overcome. I forced myself to learn coping strategies for this weakness. And now my time management is better than ever, right? So there's a way to actually genuinely talk about a negative, right? I'm not very good at XYZ. And then talk about what you did about it, how you are working on it, how you plan to improve that thing, right? You don't want to be like, well, I'm not a very nice person. And then just like leave it at that, right? Like, I've struggled with my customer service in the past, however, comma, and then that's where you fill in the blanks. They're going to want to know, tell us about a time that you had a like tell us about a good clinical experience, and they'll kind of let you fill in the blanks there, right? There's so many different possible questions that they could ask you. They might ask you about, how would you feel if, or how would you respond if? So in the ER, we have critical patients, we have literal matters of life and death on our hands. And there are times where we are in a situation like a code, or where someone is crashing, or a trauma, where maybe a physician yells at me, right? And it's not that they're trying to be mean. It's that they're under stress and they are concerned and they are trying to, things are high pressure. So they asked me in my one of my ER interviews, so if you were in a situation where, let's say, a patient was coding and a physician yelled at you, how would you handle that? And that's your time to say whatever it is that you would do. But again, you want to make sure that you're not like, well, I would start crying in the middle of the code and be totally useless, right? You want to say, so in that moment, I know that we are all in the same team, and that team is taking care of our patient. I know that we are constantly working towards our patient's best interest, and that in times of great stress and emergency, people can act in ways that they may not normally. So that is something that I would let roll off of my back in the moment. Now, if that were to be a recurring issue, I might want to talk to that person privately, when the time was appropriate to address that behavior and clear the air. However, whatever it may be. So be ready for, what would you do if? And not necessarily like with clinical questions, like what would you do if your patient had chest pain? But more like talking about workplace scenarios. What would you do if, or how would you feel if, or how would you handle this situation? Also be prepared to answer some basic clinical questions. I was not prepared for this. I was thinking like, we're just chatting away about like my experience and tell me about a time you did something well. And instead, at the end, she's like, so I just want to ask you a couple of clinical questions, just to kind of, she said to me, she was like, I know you're still a student. I know you are not an ER nurse yet. I just want to kind of gauge where you are in your critical thinking. And immediately I was like, oh my God. Oh my God, I'm panicking, right? I'm immediately, everything I've ever learned about nursing just like left my brain. So she did ask me questions like, what would you do if you had a patient who presented to the emergency room with chest pain? And that's where I was like, okay, well, chest pain could be a lot of things. And so I would definitely want an EKG. Certainly if this patient looks to be unstable, I would want to get the provider right away to come evaluate them at bedside. I'm going to start on the IV and draw labs, and I'm definitely going to advocate for some pain medication for this patient. Whatever it is, they're not expecting you to just like check off boxes of like, I'm an ER nurse. I want a D dimer and a troponin and a CBC and a BMP, and maybe we'll throw in a lactate and some blood cultures. I might get a 2-view chest X-ray. And no. That's not what they're expecting. They want to see, what are you thinking about? Are you thinking about things like getting a line in labs? Are you thinking about getting the provider to the bedside? Are you thinking about advocating for your patient's pain management? All of those things, that's really what's at stake. And then also, is anything in your answer like scary. Is there anything where you're like, well, I would give it 20 minutes and like reassess? Like that's not great. So whatever it is, you're not expected to be an expert. They just want to see where you are now and where you are with your ability to think critically. So don't panic if they ask you clinical questions. It's gonna be okay, I promise. I was really scared. I was really scared. I remember being like, I don't know words anymore. I don't know what is a chest pain. So don't panic about those things. Now, that's kind of how that first interview is going to go. And at the end, with almost guaranteed certainty, they will say to you, do you have any questions for us? And you better have questions for them. Not that they're sitting there like, I wonder what they're going to ask me, but rather, first of all, it helps you to stand out, to be memorable. Do not ask about pay. Do not ask about the weekend rotation. Do not ask about how much PTO will I get. Those are questions for like the HR recruiter. Those are questions for once they've made a job offer to you. You don't want to ask those questions. It's not a good look. What you do want to have is a kind of a couple of questions on deck that you can pull from. I have like 5, that I like might, depending on the circumstance, ask. One of the ones that I always ask is, can you describe to me the culture of your unit? The way they respond tells you boatloads. First of all, if they're like, ooh, well, we're not doing great here. Immediate red flag, right? And now I'm not saying like if they hesitate, I just mean like if they're like, well, it's listen to the words that they say. Do they say that it's a competitive unit? Because what I hear there is catty, right? I hear that we are not supporting one another, that we are competing against one another. High stress, again, like, yeah, it's medicine. It's going to be high stress, like, but the fact that you're calling it out, not great. Supportive, encouraging. We are a culture who cares about seeing our employees thrive, no matter where that may be. We another red flag is we're all a family here, right? You're not a family. It's an employer. It's an employer and an employee relationship. You're not a family, and you don't want to be a family, because if you are their family, then they get to take advantage of you. So we are a family here. Not great. We are all friends here. We look out for each other. We like to hang out with one another outside of work. The way I would describe the culture of my unit, for instance, like if you asked me this, I would say my unit, my emergency room is incredibly supportive. The people are the thing that I like the most about my unit. I know without a doubt that even if I have a bad day, even if I have a bad assignment, that I'm going to be surrounded by people who are not going to let me drown. We look out for each other, we have each other's backs, and we help one another so that when we need help, we will be helped. That's how I would describe the culture of my unit. That to me is a green flag, right? Talking about the ways that we help to support one another, we help to, as I climb, I lift. That is very important. So I always ask that, because the words that they use and the way that they respond, how quickly they respond, tells me a lot. Another question that I like to ask is, when you imagine the ideal candidate for this job, um, what do you see? Or who, if you had to describe to me the ideal candidate for this job, what would they look like? Not physically, but like what would their characteristics be? This allows you to see if you are a good fit, and allows them to also consider all of the ways that you are a good fit. The ideal candidate would be a self-starter, and they would be driven, and they would be a good teammate, and blah blah blah. And meanwhile, they're thinking, and based on the answers that you gave me earlier, you are those things, right? So it's a nice little way to like kind of tie it all together. Another one is, do you have any reservations about my ability to be successful in this unit? I don't want to say, do you have any reservations about my qualifications? Because you don't really have any qualifications as a new grad. And I don't mean that in a derogatory way. I just mean like your qualifications are that you will hold a license, right? So don't ask it that way. Do you have any reservations about my ability to be successful on this unit? Because this then allows them to either say no, in which case you're like, yeah, okay. Or for them to say, well, I am a little bit concerned about XYZ. Now, you need to respond to that. Thank you so much for bringing that up. That was a concern of mine as well. However, I can tell you that based on the information that was provided to me in this interview, I really think that that's not a concern because whatever. Or maybe they misunderstood something, right? That happens sometimes too. Maybe it's like, yeah, well, I'm really concerned about the fact that you have never, I don't know, like you have no medical experience. And you're like, oh, no, I actually do. Whatever it is, whatever the situation is, it allows you to respond, to clarify, and to make sure that you're on the same page. There's a lot of, if you just Google like questions to ask at the end of an interview or something. Like, I'm sure you will find tons, but those are like the three big ones I like to do. Tell me about the culture of your unit. And I'll tell you that one time in an interview, I asked that. I said, can you tell me about the culture of your unit? And this hiring manager looked at me and said, that is a phenomenal question. And I knew in that moment that I was going to be offered the job because it these questions help you to stand out, right? If at the end they say, do you have any questions for us? And you go, no. Okay. You're kind of a milk toast candidate, right? You're kind of just like white bread. You're kind of the turkey sandwich of candidates, which is to say it's fine. Like, but there's nothing that really stood out. It's not memorable in some way. Can you tell me about the culture of your unit? Could you describe who you would believe to be the ideal candidate for this job and their qualifications and characteristics? And do you have any reservations about my ability to succeed on this unit? Another good one is uh, a year from now, what would your expectations be of me? Meaning, a year from now, do you expect me to have an additional degree? Do you expect me to be board certified? Do you expect for me to be charge nurse? Do you expect me to be precepting? This also gives you information about how quickly they expect you to move. Because if in a year from now they expect you to be charge nurse, oh, you're a new grad, baby. No. And I'm not saying that that doesn't happen, and I'm not saying that it might not happen, but I'm saying you should take that as a red flag and consider, yikes. If they say a year from now, I would expect that you are able to function independently, confidently, and competently. I expect that you know who to ask when you need help, and I expect that you ask for the help when you need it. I expect that you are interested in pursuing additional educational opportunities that the unit provides, and you have XYZ requirement for education. Great, beautiful. We love that answer. But if they're like, well, within a year, we expect you to be precepting. Okay. Yikes. I'm not saying don't do it. I'm just saying take that under advisement. A red flag doesn't necessarily mean stop. It just means let's slow down and consider all of the information. Okay. Um, After that interview, you will hopefully hear back. And also, you want to send a thank you email within 24 hours. Okay. Within 24 hours of your interview, send a thank you to whoever it was. Dear so and so, thank you so much for the opportunity to meet with you today. I had a really incredible time getting to learn more about your facility and your unit. It sounds like the culture on your unit is phenomenal, and I can't wait to be a part of it. You don't make it like maybe, like, and if you think that I would be a good fit, I would love to maybe, nope, you say, and I can't wait to work together. I can't wait to be a part of your unit. You just tell them that that's what's happening. Whoo, it's a power move, but baby, we love a power move, okay? And that's the confidence. That's the thing that says, like, I belong here. And that's a great thing to thank them for their time also. Please don't hesitate to reach out if you have any additional questions or concerns. I look forward to hearing back from you. I look forward to speaking with you further, whatever it may be. Hopefully then you will hear back and you will be offered the job. You will be, whatever it may be. You might have a second interview. I actually had 3 interviews. I had an interview with the HR recruiter who basically pre-screened me, like, is this girl an idiot or, can she work here? That it was very basic. My second interview was with the clinical nurse manager of my unit. It was a phone-based interview. We talked for about an hour. And then my third interview, she said on the phone to me, she said, I think you would be a great fit for this unit. I would love to bring you in for a peer interview where we get to have you shadow one of our nurses. You get to see the unit to make sure that it is a good fit for you. Green flag, hello. And then we also get to get feedback from our nurses who work here to make sure that you would be a good fit on the unit. Another green flag, right? That they want to make sure that the nurses that work there are happy with the people that they're hiring, and they want to make sure that you're happy with the unit that you would be joining. That is like, yeah, that's the thing that I want to see, right? That makes me so happy. So in that kind of an interview, you would absolutely be expected to wear scrubs. Clarify it, like, so is that appropriate for me to wear scrubs? Yeah, so clarify it. But yeah, then I went to the unit, I shadowed, I followed this nurse around for about an hour or two. I helped with some patient care. I then got to ask that nurse questions. And this is where the juicy stuff is, right? Tell me how long you've worked here. Tell me what you love about this unit. What complaints do you have about this unit? Have you brought any of these complaints to management, and what did they say? What's the worst part of your job and what's the best part of your job? And listen, because if the worst part of their job is related to just stuff you can't control, that's awesome. Like, the worst part of my job is, when I get someone who's really sick and we're not able to get them up to the ICU quickly enough and they crash. Like, okay, that happens, right? The worst part of my job is morning huddle every day because, they just tell me 150 different things that have gone wrong. Oop, nope, red flag. So the best part of my job, is I feel respected on this unit. I love the autonomy that I have. I love the relationship that I have with our physicians, our NPs, our PAs. I love this unit culture. I feel like I fit in. I feel like people care about seeing me succeed. Love that. The best part of my job is clocking out at the end of the shift, which is a thing that someone said to me once in a shadowing interview. And I was like, oh my God. So yeah, use that opportunity because these nurses aren't hiring you. These nurses don't care, like in terms of like management, they don't care if you come to work here or not. They're just here doing their job. So they're going to tell you how it really is. You just have to ask the right questions. This is another good question to ask in an interview, or to ask in that shadowing interview with a nurse. So do you see them shortening people's orientations often? Or do you get the full orientation? They told me that I was going to get 16 weeks of orientation, but like, is that actually going to happen, or are they pulling people out early? It is a red flag to me to pull you out of orientation early, because this is exactly right. They're trying to help a staffing shortage and cover their butts. You were told X number of weeks of orientation. It is 100% appropriate to say, I do not feel comfortable coming out of orientation. I will not, I am the only one who can protect my license. I am the only one who cares about that piece of paper right there, right? I'm the only one. So it's my job to protect that license with my life. So 100%, if I were in that situation, I would say, I do not feel comfortable coming out of orientation early. I do not feel competent and confident in my ability to function independently as a nurse on this unit yet. I would like to proceed with the full amount of orientation. And if that cannot be afforded to me, then I cannot work here because I feel that it puts my license at stake. Just say it simply. Just say it simply. And move it up the chain if you need to. If it's your unit educator is trying to pull you out early, go to the clinical nurse manager. And if they say no, go to the unit manager. Do whatever it is to get up that ladder, because we are not risking our license so that the hospital can help their staffing shortage. That's not happening. So, yep, 110%. Okay. Any last questions? Any last questions? Now is the time. This was so much fun. I could talk about this literally forever. I love hearing about the things that you do. I love hearing about the places that you interview, the places that you get jobs. Genuinely, like, this is my passion. This is the thing that I get excited about, other than ER nursing. But I love seeing you start your journey as new grads. I love seeing you have those aha moments. I love seeing those things click. And I love helping you and being there in your corner. So if you have like a great interview or whatever, I want to know about it. Like, I want to hear about it. If you had an interview that went terribly and they asked you some wild questions, I want to hear it too, bestie. Like, I am so excited for everything that you're doing. I want you to know that what you are doing is very difficult and you are handling it well. That every day that you choose to continue to get up and keep working towards your goals, I'm just incredibly proud of you. And if all you did today was get out of bed and drink some water and continue to breathe, I'm proud of you for that too. And if you didn't even get out of bed, I'm still proud of you. Should I apply for multiple hospitals or stick with the one I want to work in? My answer to this is it comes down to, is the hospital make or break for you? If the hospital is make or break for you, then stick with the one that you want to work in, because you're just wasting everyone's time applying for those other ones, because you don't want to work there. So for me, ER was the make or break. I had to be in ER. So yes, I had a hospital facility that I wanted to work for, and I didn't end up working there. And I'm glad that I didn't. Like, it worked out well. But they wanted to put me in ICU. They wanted to put me in their acute care, or I'm sorry, their critical care fellowship in the ICU. And I said, you can't promise me ER? And they said no. And I said, no, then that is the thing that's most important to me, is the ER. So if the thing that is most important to you is the hospital system, stick with just that one. If that's just the one that you're most interested in, but you're open to working elsewhere, then absolutely, apply around and see. Are we having a Black Friday sale? Yeah, of course we are. Of course we are. Black Friday is like my favorite thing, because that's when, that's personally, I'm a huge shopper. So that's when everything's on sale. So yes, I don't know any of the specifics. I don't do any of that stuff. That's all our amazing marketing team who handles pricing and sales and all of that good stuff. So I have none of the details. And I'm 100% serious. And I wish that I had any information for you. But also, okay, side note, did you guys see our Level Up RN membership? You might be getting an email today, possibly. I'm just saying, it's not YouTube, it's a different membership. It's pretty great. And you should check it out. So, okay, listen, it's 9:00 at night here. I have to go to bed, but I'm just saying you should definitely check your email if you haven't already. And if you're not on our email list, you should probably sign up for it so that you can be the first to know for things like, I don't know, this is super cool new membership that might be a thing. So anyway, this was a blast. Thank you guys so much for hanging out with me. It should be coming literally momentarily. Literally right now. It just went out right now. So go check your emails. I will see you on the flip side. We'll be back. I don't have the schedule for next month's live events yet, but we will let you know as soon as we do. Of course, follow us on social, because we'll tell you there too. Join our email list so that you get all of the details before everybody else, because I might have let the beans spill 2 minutes earlier. But anyway, point is, you're doing an amazing job. I'm super proud of you, and thank you so much for hanging out with me. Bye, friends.